What is one of the commonest things you hear in your office, Dr. Seeley?
Huh?
What is one of the commonest things you actually hear from patients in your office, besides, am I a doctor?
That is the commonest.
That is the commonest things, yes.
Yeah.
Next is fatigue. We hear that quite a bit of that, yes. I'm glad you remembered.
Yes.
But, you know, we are in the midst of a global energy crisis, and I'm not talking about gas here. Maybe not. But, yeah, we are losing our energy in our society. We are becoming more fatigued and more tired of late. And we hear it so often as a complaint. What are some of the causes of those? We're going to give a top 10 cause of fatigue, Dr. Seeley.
We are?
We are.
Well, number one, let's say anemia. Now, if a person's having menstrual cycles, usually women, they're going to lose blood each month, and that could lead to iron deficiency. Other people, if they're a strict diet, B12 deficiency, any of these things that drops the hemoglobin, carries the oxygen in the blood, that can be pretty tiring.
Yeah, so we check for anemia. We also check for your thyroid, because a sluggish thyroid can also lead to fatigue. Now, the thyroid's a little gland in your neck here. It's kind of a stupid-looking gland. Good thing you can't see it. But it may be a normal size, but may not be functioning right.
Let's say number three, urinary tract infection. Also fairly common in women and in nursing homes. If it's associated with confusion and fatigue, you know, look for a urinary tract infection. That's a real common cause.
And here's one that may surprise you, but caffeine, in fact, can have a counterproductive effect and make you further tired. Initially, you sort of get that boost, but afterwards, you may pay a price for it with fatigue. So too much caffeine overload, fatigue.
Sorry, I'm tired. Is it number five? Let's say food intolerances. If there's foods that aren't right for your body makeup, if you just have a sensitivity to them, not a true allergy, but they're just kind of like irritating like a toxin to your system, your body will react by being tired. So be suspicious if you get sleepy within about 30 minutes of eating. Do an elimination diet and eliminate those foods and see if you perk up your energy.
Another one is obstructive sleep apnea. If you wake up fatigued and tired, that could be because you're not getting enough oxygen during the night. Of course, if you wake up dead, it means you really have a bad case of OSA.
Number seven, undiagnosed heart disease. Now, not a huge cause, but as we've talked before, this could be one of the signs that ladies, I keep picking on the ladies today, but the ladies might have heart disease as they may present with fatigue, not chest pain.
If all blood tests come back normal for your fatigue complaint, we often consider depression and anxiety. That weighs heavily on the mind. The mind and body are intimately connected, and fatigue a common symptom of depression.
Number nine, diabetes. If you have a high level of blood sugar in your bloodstream, it's not getting out into your cells, so your energy drops. You get fatigued.
Number 10, it can be the chronic fatigue syndrome. Now, we would need 3 hours to discuss what chronic fatigue syndrome is and fibromyalgia, but there are horrible entities where the sufferers are constantly tired no matter what happens.
And number 11 is if you hear another top 10 list from us, that'll make you tired.
I'm exhausted.
Mm-hmm.